Welcome to a place of wellness and healing for both your body and mind. Get ready to live a happy, healthy, energized life that totally rocks. You're listening to Straight Talking Natural Health, a no BS podcast for busy people who want to ditch the fatigue, find balance, and feel great, with your host and naturopath, Jules Galloway. Hi there. I'm flying solo today, so no guests, just little old me. So the reason that I'm doing that is because every now and again, I feel the need to jump on and talk to you about something that I'm seeing in practice a lot. And, as much as I love to get guests on to talk about things, sometimes I just really want to go over the nuts and bolts with you as well. So I'm going to be jumping on occasionally. This won't be happening every week. They'll just be happening here and there, but there'll be occasional episodes about common issues that I see in practice that I want you to know about. So beware. They may get a little ranty or a little sweary at times as we go over things like how to spot symptoms, how to test for these issues, why your doctor may not have picked it up, and of course, what to do about it. Woohoo! Okay, so today's topic is thyroid, and in particular, thyroid testing. And there's going to be a special focus here on hypothyroidism. Okay, so let's go over the scenario. So the doctor says you're fine, but you've got all these signs and symptoms of hypothyroidism. Now, let's go over a few of those. There's so many, but this is just a bit of a selection. The top one I see is fatigue. Absolutely. I see that one a lot, tired women coming to me. The next one that I reckon I see the most is weight gain, or kind of that creeping on of weight, and then that real inability to lose weight. And then there's lots of other bits and pieces as well, like people who feel the cold really easily, that intolerance to cold weather, dry skin, puffiness, especially around the face and the abdominal region. Constipation. Now, this is a funny one because every time you look up symptoms of hypothyroidism, it's there, it's in every single list. You'll always see it, but it's not everyone. I get women who come to me who have the opposite of constipation going on. So it's not always the case, but it is definitely there in all the literature. It's always in those symptom lists. Joint pain is another huge one, and also muscle pain and weakness. So they quite often go hand in hand, where people will come to me and they'll be like, oh, I just feel so sore, so knackered after I do things. They might be trying to go to the gym and getting an unreasonable amount of DOMS, which stands for delayed onset muscle soreness. So, those people who are like, oh my God, everything just feels like an effort and I hurt. Oh, it's probably just old age. No, it's not just old age. Hair loss. Oh my God, that should have been further up my list. That's a huge one, but it's not massive amounts of hair being lost. It's just an unreasonable amount coming out when you're washing your hair in the shower, handfuls of hair every time you wash your hair. So it's not a bald spot or something like that. It's not where you see a really obvious spot where the hair has come out. It's just sort of gradually and ongoing thinning of the hair over most of the head. Also, there's a lot of mental health stuff that goes on with hypothyroidism. So one that I see a lot is anxiety. Another one would be depression. I also see things like brain fog, memory issues. And when people come to me and they're like, I can't find the words, I'll be halfway through a sentence and I can't find the words for really simple things. And I call it that Homer Simpson moment, because if you're old enough like me to remember The Simpsons, and there's those moments where Homer would have that inability to find the word for a really simple thing, he'd be like, the thing that you put the water in, that you drink out of, and someone would be like, a cup, and he'd be like, yes, that's it. The other one that I see quite often in women, often sort of younger women who are still menstruating, is heavy periods. That is a huge one as well. So when people come to me and they're like, my periods are getting heavier and heavier, thyroid is sitting there in the differentials in terms of things that this person might have going on that's causing this symptom. So yeah, look, there are other symptoms and signs as well of hypothyroidism. They're just like the top ones, and you don't have to have all of them or even most of them in order to have a thyroid issue. You might just have fatigue and puffiness and hair loss, or you might just have anxiety, brain fog, and some weight gain. Like, you could have just a bit of a combination of a few of these things, and that would be enough for me to pull the trigger on some thyroid testing for you. So why do people go to the doctor with these symptoms and the doctor does testing and then the doctor says they're fine when they're not? Have you noticed that happening? Because I know I sure have. And look, there's a really good reason for this, actually, and that's because, and this is not very well known in Australia, but the test that they do that's covered by Medicare is called a TSH test. And TSH stands for Thyroid Stimulating Hormone. And it's even in the name that you begin to realize that it's not a thyroid hormone, it's thyroid stimulating hormone. So they're not even testing your thyroid here. They're actually testing something else entirely, right? So, you'd be sitting there going, what the hell? I thought they tested my thyroid. Well, they kind of did in a roundabout way. Thyroid stimulating hormone is not made in the thyroid. It is made in the pituitary gland. So up in the head, up in the, behind the forehead, you've got this little guy called the pituitary gland, and the pituitary pumps out TSH in response to how much thyroid hormone is hitting it. So on your pituitary, you've got these receptors, and they sense how much thyroid hormone is running around in your bloodstream and hitting these receptors. And then your pituitary either applies the accelerator or the brake and tells your thyroid how much actual thyroid hormone to make. So it's like this feedback system going on. It's really cool. But, there are things that can go wrong. So if your pituitary isn't tip-top, or if there's a receptor issue, or if there's a communication issue, then it might not sense the right amount of thyroid hormone, or it might not send enough messages to your thyroid to tell it to make more thyroid hormone. So yeah, your TSH is essentially your pituitary's accelerator/brake system. So say, for example, you've got too much thyroid hormone running around in your body. Okay, so too much T4, too much T3, your pituitary will sense this and it will actually drop your TSH. So you'll have lower TSH, and that then tells your thyroid to make less thyroid hormone. It's applying the brakes. On the flip side of that, if you've got too little thyroid hormone running around in the body, the pituitary should sense that, and then it will be like, oh, there's too little going on. I better whip the thyroid, as Tara Nelson says, and I think she's even said that in previous podcast interviews with myself. It whips the thyroid into making more thyroid hormone. So your TSH goes up, so your pituitary produces more TSH. It presses the accelerator. It tells the thyroid to, come on, mate, pick up your pace. And then the thyroid makes more thyroid hormone. So as you can see, there are things that can go wrong though. And I've seen cases in my practice time and time again where people have a perfectly normal TSH and not enough thyroid hormone going on. I have seen it. It exists. They are a very small percentage of people out there. So this is the thing about TSH testing, right? It picks up most cases of hypothyroidism, most. And it must be, it must be easy or cheap or reasonable to do, because that's the one that our medical system leads with. Now, that's great for 90-something% of people, but there will be a very, very small group of people who have got a perfectly normal TSH whose thyroids are not functioning properly. Those people end up going under the radar, because in Australia, in our Medicare system, you will only go on to have your T4 and your T3, the two key thyroid hormones, tested if your TSH was out of whack. Now, The other problem with this, yeah, I've got problems with this. The other problem with this is the reference range for TSH is so broad compared to where I would like it to be. So most naturopaths will want your TSH to be between 0.5 and 2. Some naturopaths will even say between 1 and 2, depending on who you go to and depending on whose reference ranges, which functional medicine reference ranges they follow. But let's say, for example, it has to be between 0.5 and 2. Now, the Australian reference range for TSH is 0.5 to 4. So if you've got a TSH that's over 2 and less than 4, you will be told your thyroid's fine. But as soon as, in my opinion, as soon as your TSH starts to climb over 2, you're beginning to have a thyroid issue. You might not have card-carrying hypothyroidism, Hashimoto's, or something like that yet, but you are on your way to having that. And so a naturopath would want to see that in its inception. We want to head it off at the pass. We want to spot it before it turns into something that we can't fix. So, like, for example, recently I had a client who had a TSH of 3.8. She was told that her thyroid was fine, but that is the only thing they had checked. So 3.8. So she's getting close to that 4.0 where it would trigger our system to then test their T4 and T3, but she wasn't there yet. And so her TSH is 3.8. I organized for her to go and have her other thyroid hormones tested privately, which costs money, but we did it. And she came back with a very low T4 and a fairly low T3 as well, actually, but her T4 was like quite low. And so her hypothyroidism wasn't picked up because her TSH hadn't gone over that threshold yet. But we could see that she was suffering. She had so many of those symptoms from our previous list that I was going over with you. And so why would you wait for things to get worse when we can actually start to address them now? And so this is why people go to naturopaths and functional medicine practitioners and integrative GPs, because they know deep in their bones there's a problem. They've read through the symptoms. They've Googled symptoms and signs of hypothyroidism. They've looked at it all and they've gone, oh my God, fuck, that's me. That is so me. But then they get told that they're fine and they're like, I don't believe this. I feel it in my bones that something is wrong. And something might well be wrong. And I think this is why it's important that if you've got all these signs and symptoms and you're feeling sluggish and you're feeling tired and you're feeling anxious or you're feeling foggy, or if you're losing hair, like, go and get another opinion and maybe pay the money to get these other tests. So the first thing that you would want to pay for if you go into the private, like get the private testing done through either a naturopath or an integrative GP or whatever, is to get your T4 looked at and your T3 looked at. And again, your functional medicine practitioner, your nutritionist, your naturopath, if they look at the world in the same way as I do, then they will have their own reference range for T4 and their own reference range for T3, because again, like, our reference ranges are more narrow than the Australian standard reference ranges, because again, like, there are things that we can do. There's tools that I've got that we can start to use that we can do when things are at a subclinical level before you get to clinical hypothyroidism or Hashimoto's. And I don't know if I explained before, but Hashimoto's is autoimmune hypothyroidism. So it's actually where your immune system is causing this issue with your thyroid. So the other things that naturopaths might look at are reverse T3. Now, this is a bit of a curly one, and I won't go into it too much, but reverse T3 turns up when you're stressed, and your body will preferentially make reverse T3 instead of making the thyroid hormone that you actually need, which is good old T3. Okay, so sometimes when you're stressed, instead of making good amounts of T3, it'll stop making lots of T3 and make this stuff called reverse T3 instead. So often if we've got a client who's stressed, if we think they've got high cortisol, we might have had a cortisol test done and we're like, oh, yes, that's not good. We'll often look at reverse T3 to see if that's the thing that's being preferenced instead of the body making T3. And then we actually don't treat the thyroid, we treat the stress. The other thing that naturopaths love doing, and I know a lot of integrative GPs and nutritionists do as well, is we love to test antibodies. Now, the amount of times that people have come to me and they've got hypothyroidism, they're on thyroxine, and I said, okay, when did you get diagnosed? Was it Hashimoto's? Because like over 90% of hypothyroid cases are Hashies, and they've said, I don't know. And I'm like, how can you not know? Like, you need to have these diagnoses done. Like, is it autoimmune or not? And they're like, it's never been checked. No thyroid antibodies have been done. And then I realized, I was like, why the hell are these doctors not doing this? But then I realized that it doesn't change their course of action. So if it doesn't change your course of action, is it necessary or even ethical to test? And no, it's not really. Because think about it. If your T4 drops below 9.0, right, your doctor's going to give you thyroxine. If it's Hashimoto's and that causes your T4 to drop below 9.0, the doctor's going to give you, you guessed it, thyroxine. So it literally doesn't change their course of action to know whether your disease is autoimmune or not. All they do is look at your T4 and give you the appropriate amount of thyroxine, which is synthetic T4, to boost your levels. That's it. That's what they do. And so I can understand why some GPs aren't testing antibodies, because it's not going to change what they do in that moment. So for them, it seems to be unnecessary. And in terms of what they're going to give you, it is unnecessary to know. But as a naturopath, it's like totally necessary, because it changes what we do with you. If it's autoimmune, we start to work on inflammation, we start to work on stress, and we most definitely start to work on the gut, because these are all things that can drive these autoimmune antibodies and processes and attack the thyroid and stop it from producing thyroid hormone. So this is like shit that we need to know. But for a doctor, it's not going to change what they do. But for me, as a practitioner who will go in with gut healing, will go in with anti-inflammatories, will go in with things that help to modulate your response to stress. Like, it's everything. This is information that I need to know. So I will send clients to go and get things done, like their TPOs, thyroid peroxidase antibodies, the thyroid globulin antibodies, which will usually be listed on a form as either ATGs or TGABs. And then if I think they're hyperthyroid, which we haven't spoken about much today, and we won't go into too much today, but if I think their thyroid's revving too hard, if it's going too fast, there's other antibodies that we can also add on that will also help to look for that, like TSIs or TSH receptor antibodies. So as you can see, there's so much more we can do. Unfortunately, it's not always covered by Medicare. And that's the thing that really gets my goat, because people have to have the funds, they have to have the money to be able to fork out and pay for their own thyroid testing. But as you can see, it can really be a game changer, and it can really help to move this case forward and get to the bottom of what's going on. So if someone comes to me and they've got these signs and symptoms, and they're, where I'm sure, they're sure, I'm like, this looks like a thyroid case. They're like, I feel like a thyroid case. Then these are the tools that we use to do the detective work and investigate further. So I'm really grateful that naturopaths have this at their disposal these days. Like, it's an absolute godsend that we can do this sort of testing to get to the bottom of things. And it really, really helps the patient as well, the client as well, because when they come to us, they finally get the answers that they've been looking for so long. So I hope that helps you to understand a little bit about how we approach thyroid testing in practice and why we do things the way we do. So if you liked this episode, stick around, because there'll be other ones in the future about other health conditions and concerns as well. And yeah, look, reach out to me if you do have concerns about your thyroid, or if you would like to know what to do next. You can either book in with myself, or I have this network of amazing practitioners Australia-wide, and I can always find someone who you can go and see. So look, definitely reach out. definitely, drop me a line, either Facebook or Instagram. I'm Jules Galloway Health. And look, let's chat, because if you're sitting here and you've been nodding your head and you've been like, oh my Lord, it's like she's talking to me, then it's time to do something about it. Okay, see you in the next episode. Bye for now. I hope you enjoyed listening to Straight Talking Natural Health. If you liked what you heard, make sure you hit subscribe so that you're the first to know when new episodes drop. In the meantime, head over to my website at julesgalloway.com. There's all kinds of resources available there if you're keen to get started to live your best, healthiest, most energized life. When I'm not podcasting, I'm seeing clients one-on-one via Zoom, so why not book in and let's work together? I love helping my clients to heal from fatigue, anxiety, inflammation, gut problems, and chronic health issues, to name just a few. All of this and more is available right now over at julesgalloway.com. That's all from me for the time being. I look forward to diving in with you again in the next episode. Bye for now.